Many thanks for coming tonight. Memorial has taken a lead in survivorship. We have a whole program here now that's devoted to survivors, and I think that probably we're among one of the first hospitals to really seriously take up the fact that just because your treatment's over doesn't mean we should say goodbye and not ever see you anymore. So talking about the issues that you feel are important is really what I'm about, and to have you bring them up so that we can chat about them, get different opinions about them, and put it on a program for the future if that looks like it's what you think we should do. So what's the good news? Good news is there are 12 million cancer survivors in this country today. That's pretty remarkable. So you are a part of a cohort of people who didn't exist at 50 years in the past, and I think that it's a time when being a survivor has a very different meaning and a very positive kind of potential for interaction with people around you. Just the fact we're sitting here and we're talking about these issues is a far cry from how it used to be. There are not many advantages to aging, but one of them is I can think back and tell you how things used to be. And that's kind of interesting because when I started in this field 30 plus years ago, there were not very many cancer survivors, but those who were a survivor wouldn't tell it because it had to be kept a deep, dark secret. Why? Because you might lose your job. People thought they'd catch it if they talked to you. So there was a kind of secrecy, and which leads to a kind of shame and like, what did I do wrong? I mean, why are people treating me like this? Which was an added psychological burden. Not, it's enough to have lived through the cancer experience, but to be back to normal and then to not be able to pick up a normal life was really so tragic and so worrisome for those of us who were trying to help people with the psychological side. I mean, just some examples. We had a wonderful volunteer who worked with us who had chronic leukemia, and he was quite healthy at the time. And he told me of going to a cocktail party, and everybody got a glass, and he got a plastic cup. It was very clear that he might be catching, he might catch it. People, other stories, people moved, recognized it. The desk, that their desk got moved away from its normal place and away from other people being too close. So it says a lot about how much more society understands about cancer, how much less prejudice there is, and prejudice comes out of ignorance. So people know more about it. We talk about cancer. We have it in the newspaper almost more than you'd like to have it in the newspapers, but it is a topic that's around every day. I had another experience, just to give you a flavor of that time, when I came to New York and I started to work at Montefiore Hospital, and I said, to the head of oncology, I'm really interested in understanding how patients cope with cancer, and that's a field that I'd really like to study more. And this oncologist said, "Oh, Dr. Holm, I'm so glad you're here. Delighted to have you study my patients. Just don't tell them they have cancer." Now, you have to remember that, too, that people were not given their diagnosis. And it was just thought so frightening that they wouldn't even want to know. So me wanting to study psychological reactions, I had a little bit of problems with not being able to tell people why it was I was talking with them because we couldn't use the word. Well, so look at how things have changed. As I like to think of it, cancer came out of the closet about 1975. I think there was a tipping point. Happy Rockefeller and Betty Ford, both first real public figures who announced to the world breast cancer and even chemotherapy. That was important. We began to get people writing books about their illness. Betty Rowland was the first one who wrote about First to Cry. There was a movie about cancer. I think that was Love Story. So you begin to see the media dealing with it a little bit, a little wary, but dealing with it nevertheless. And I think around that time, we really saw people saying, look, what did I have? Or, did I have breast cancer? I want to know what my diagnosis is, and I want to know the treatment plan, and I don't want a mastectomy until I've had a biopsy and thought through what kind of treatment I want. Women had a lot to do with that. There's always more women in these audiences than men. So I thank you for coming, because you like to, you're good participants in these kind of issues that have to do with the psychological. So those are some of the ways that I think being a survivor today is a very different issue to what it was 40, even 50 years ago, but probably even less. I think around the 70s was when we really saw the change. And one of the questions that's continually come up is, well, what is a cancer survivor? Thank God we got rid of the word cancer victim, which I heard for so long, way back, years back, and we got to the word survivor, which I think is a better one. But then we went to this big question of, well, when do you become a survivor? Do you have to live 5 years and prove you're all right to be a survivor? Well, no. I think that a very smart doctor named Mullen came up with, there are seasons of survival. So first thing you have to do, the first season is the treatment season, and you have to survive the treatment. And so you're really a survivor from day one. When you get the diagnosis, you're already facing what's going to be survivorship. And so this first season is getting through the treatments, managing them as best one can. And those of you who are survivors know how hard that can be sometimes. But the second season that Fitzmullen described was the transition from being the ill person to a normal person again, to your normal life. And that takes some doing, surely. And then last is kind of what's the long-term impact of the illness and what kind of long-term effects it may have on you and your family and your kind of perspective on life. Some people will say life became dearer to me. I appreciated smelling the roses more. Other people say, I don't want to ever hear of that. It didn't make any difference for me. So everybody's different. I think there's no one-size-fits-all in terms of how you perceive what's happened to you and how you kind of incorporate it into your life.